there was some criticism in '93 that the whole thing fell apart because there was just a Clinton bill and that there were no.
Oh, they started out. We started out in '90, but Clinton spent 22 months on his. We started out in '93 as bipartisan, and there was a lot of what the word is then, because Hillary, who wasn't accountable to anybody, never took an oath, was in charge of health care. She's like one of the czars, but czarina. But then it just got down into messy politics, and I'm take my share of the blame too.
Are you seeing similarities now to what you witnessed firsthand back in '93 and '94 that might lead to this failing as well?
I think they're a little further along now. We were looking for a compromise, and I had Senator Danforth, who's a good straight shooter, and Senator John Chafee from Rhode Island, are the same moderate Republicans. Were my representatives. They had a little working group, and they got so close. And then I don't even remember, some political thing happened and blew it up. But now if they get the Baucus bill to the floor, and they can make a deal on some amendments, they could end up with a pretty good bill. Obama wants a bill. This is the biggest thing in his administration, domestically. Afghanistan would be the biggest foreign policy.
Quickly, Senator, how are you doing? I mean, you haven't been back in a while. We all wrote about your little operation here a couple.
Yeah, and I'm about to get another. I'm doing fine except for my legs. I can't get out of this chair, for example, because I don't have the muscle, and I have the arthritic knees, but it's the kneecap, not the joint. So there's supposed to be some doc in Chicago that does it in the morning, and you go out and have dinner with him at night.
That's a pretty good deal.
Yeah.
So you're going in for more surgery here soon? Is that what you're?
Well, I'm exploring because I got a lot of time and a lot of things. I want to come home this summer and to spend the time floating around Kansas, doing nothing, except seeing my friends, and I haven't been able to do it. So I still want to do that, but and I'm becoming more. I was intentionally not very active when Elizabeth was in the Senate because somebody accused me of trying to help my wife or something. So I'm a little more active politically now.
But you don't. Do you think the Senate has changed from when you were there?
Well, it was a big loss when I left. Yeah.
We can all agree with that.
Yeah.
Certainly run again. There is an open seat in Kansas.
Ron, I can't hardly walk. Yeah.
But do you think that the sort of the
Yeah, I know Dave. It's a tough question. I haven't been there, and I don't go up there very often. I think there has been kind of more personal, like not calling you a liar, but being right on the edge, and things that people say. I mean, we used to get up and say things that were partisan, and maybe I did go over the line sometimes, but they don't elect nonpartisan leaders. You know, they can.
But I mean, you saw some of that with Newt Gingrich, even with you in the mid-'90s. I mean, that whole sort of
Newt, yeah.
Yeah, tax collector for the welfare state and that type of thing.
Well, no, the thing that I think that I always remember about Newt is it's closing down the government.
Right.
In '96, when I was, not that I would have won, but I probably would have carried a couple more states. And just seemed like for the fun of it, I don't know. I used to say, Newt, my husband works for the ag department, and they got their budget approved, so he's getting paid. My neighbor's wife's husband works for Interior, and they didn't get their budget, so he's not getting paid. Now, you tell me what's fair about that. So if your budget got passed before you shut down the government, you're getting paid every month, and all the other poor people had sent.
And some people say that's sort of when it all started, where it became more of a game than policy, really.
Well, it was a personal thing with he and the president. The president won hands down. I mean, you don't do that. And Newt's gone on to writing books and mulling 2012. think he's gonna get a prize from the Dole Institute. Slipped past me. You're not gonna say that, though. I know you won't right
No.
now.
Yeah, I'll save that for when he gets here.
Well, I'd really want to give him a bigger prize.
Okay, good.
To the question on what are the obstacles for this being passed, I've never been elected to any position, so I'll defer to the senator. But from my perspective as the CEO of Blue Cross and Blue Shield, problem number one is how will these changes be financed? It's difficult for the president still to defend various approaches in 5 bills, a lot of consolidation to happen, and no matter how you do it, that's going to be a difficult thing to do to raise the new taxes to fund these changes that we feel are necessary in America's healthcare system. So we give the credit to the president for tackling these tough and complex issues. He's been resolute in saying, for example, that Americans must have health insurance and there needs to be a mandate and penalties should apply. That's absolutely right, and we at the same time know, as the senator said in his speech, how difficult that is for an elected official to support a requirement to buy a commodity that costs as much as health insurance does today.
How important is it to your company that something get done? And if we stay with the status quo, is that okay for you?
No. In fact, we fully agree with the senator that the stars are really aligned for comprehensive reform of our healthcare system. I don't think everything that's been proposed will be passed, but certainly this package of insurance reforms, elimination of pre-existing conditions, better rating and underwriting regulations, subsidies for the poor are all things that we support and have tried to make that support public with a series of full-page ads in both the Star and the Business Journal this week.
You also support the wellness provisions.
We have.
People taking on more responsibility of their own.
We pay out $2 billion a year to our 1 million customers here in Kansas City. 40% of that payout is to take care of what people do to themselves, and that is poor diets, lack of exercise, not buckling up, abuse of drug and alcohol, those sorts of things. That's something I can say, but an elected official doesn't get very far by saying, America, stifle thyself, take better care of yourself. But that's certainly something we see as a necessary ingredient for successful cost control and health care reform.